close is the hospital? The potential for loss of life is significantly increased by taking the level of care to a facility that's more than twice or 3 times the distance away. It's just common sense. If you have a patient that is in serious medical condition, our EMTs are very highly trained, but they can only do so much. You need a clinical setting for some of those cases. And yes, if they have to travel a further distance, we can expect more loss of life. This fire department here runs an average of 400 or more rescue calls in a year. The average rescue call for the members of this fire department take between 45 minutes and an hour. If Westfield Hospital is closed, the average call is going to take between 2 and 3 hours. Most of our volunteers, if not all of them, are people that are working in this community and they need to have a paycheck. And it isn't going to take very long when an employer starts seeing their employees leaving for 3 hours at a time, sometimes maybe twice a day, and losing somebody for 6 hours. An employer just can't sustain that. They can't pay somebody to be on a rescue call for 3 to 6 hours a day. I think that there is possible need for a class action lawsuit of some sort to bring the Burger Commission to task on their decisions. And I really think that the communities need to stay strong in this matter and to be firm in the fact that we need that hospital to stay open. And I don't think anybody across the state or downstate in the Albany Capital District should tell us what we need here in this end of the state.
I've run many hundreds, if not thousands, of calls to Westfield Hospital, and without a doubt I can say that facility is absolutely needed to save the lives of our community and those people that pass through our community.
If Westfield Memorial Hospital emergency room closes, it's going to cost a lot of lives. The people will not get the care they need, and it'll take much longer for them. They will have to travel more distances to get the care that they need.
If the Westfield Hospital closes its emergency room, I fear that the quality of life of this area is going to take a plunge for the worse. I'm not personally a medic or an EMT, but I often respond with the ambulance just to see if they need help lifting patients into the ambulance, bringing equipment, and the people arrayed behind me, I can stand here and tell you, save lives.
I woke up about 3:30 in the morning and my tongue hurt. And I didn't know what was going on, so I went to the bathroom, looked in the mirror, and it was swollen. So I told my wife, actually I couldn't speak, so I had to write it down, and I just wrote 2 letters, ER. So we had decided to go to the Erie VA. So we set out in the car on Route 20 to go there. And by the time we got to Brockton, which is about 7 miles from Fredonia, I couldn't breathe through my mouth anymore, and my tongue had swollen so much I couldn't close my mouth. I knew I was in some serious trouble. And so my wife looked at me, and she could see that too, and she said, "Do you want to stop at Westfield?" And so we pulled into the Westfield Memorial Hospital emergency room, and I couldn't speak at that time, and so she gave me a pencil and paper, and I wrote down, "I can't breathe." And so then the nurses immediately came out, took me into the room, and started putting in IVs. They called in the emergency room doctor, the attending physician, started administering epinephrine and also some antihistamine. The helicopter landed and they were able to stabilize me enough for transport. And I would have never made it to Erie at all, which is another 30 miles down the road. Now, if this hospital had not been here and the emergency room had not been open, I would be dead today.
If it wasn't for Westfield Hospital, I wouldn't be alive today. It saved my life. I had an allergic reaction at the end of March in 2007 and was rushed here. When I got here, they had to wind up intubating me and flying me out to by helicopter to another hospital, and I was trached in. And the doctors up there said if it wasn't for Westfield Hospital and the doctors and the fast treatment that they gave me, I wouldn't have probably been here today.
The recent statistics for Chautauqua County indicate that the population for individuals 60 years of age and over consists of 22%. My concern is, with so many seniors in Chautauqua County, what kind of an impact will this cause? What kind of traumas, tragedies will result because these individuals have not gotten to the hospital in time? Stroke patients, people with back injuries, spinal cord injuries, if they are not treated promptly, the consequences can be very severe, very debilitating. Would anybody really want to take on the responsibility, deliberately knowing that some individuals wouldn't survive, would die, or would be severely debilitated just because they can't get to a facility in time?
I definitely would like for them to keep the emergency room open at Westfield.
Please do not close the emergency room.
I certainly think that the people in Albany should reconsider and keep our emergency room open because it is definitely needed for this area.
If it wasn't for the Westfield emergency room, I would have lost my brother 3 times in just the last year. I myself was there twice in the last 2 years. So we definitely need to keep it open. There's a big community here that it supports. We just need it.
I've lived in this area since 1965, and I did work at Westfield Hospital way back when it was just a brick building, an old brick house. We used to find the emergency room of great benefit because people who were seriously injured could be brought there immediately, stabilized, evaluated, and then sent on to a better hospital where they could receive the proper care that we couldn't provide there. And for this hospital to lose its emergency room would be a great loss to our area.
It basically came about because of the sense that people wanted to see a consolidation of hospitals, a reduction of hospitals, hospital beds. And this came downhill from the federal government because the federal government basically was offering enhanced aid if, in fact, you downsized your total number of hospital beds in your state. And so George Pataki, reacting to that federal legislation, created the Berger Commission. The Berger Commission then basically recommended the closure of the Westfield Hospital. There were attempts to create accommodations within the Berger Commission report so that these hospitals didn't close. And with Westfield, they had to give up their obstetrics, but they were allowed for a period of time to keep the emergency room open. And currently what they're proposing to do is to keep open the emergency room, which requires that they have, in their estimation, 4 inpatient service beds. What we're currently asking for is a waiver from the Berger Commission finding to allow Westfield to continue the emergency room and have these 4 beds. Now the health department says, well, wait a minute, if we let you have these 4 beds, that may jeopardize the total number of beds in the state such that the federal government would deny us a significant amount of federal aid that we otherwise would get if we reduce our bed count to what the federal government wants. So it becomes very complicated between the federal, the state, and the local level.
People need to be concerned about the closure of the hospital. The primary need for concern is due to the economic impact. The jobs will be lost.
Area is predominantly rural or small village populations, and the population that's in the service area is somewhat mixed in that it includes a fairly large number of old order Amish families who do not have high mobility because of their religious beliefs. They principally go to town in a horse and buggies. Emergency care is a very important element in rural America, in part because